Dr. Lisa Cassileth converted from eating keto to a plant-based diet after she studied the health benefits of veganism. It's no surprise she disagrees with my previous guests who love the omnivore and the carnivore diets. We also talked about diet drugs like Ozempic, Wegovy, and Mounjaro. I bet you'll find it surprising to hear what she thinks about them. Ready for a totally different perspective on what we should be eating? Listen in. So Lisa, thank you so much for coming in to talk to me. For those who don't know about our relationship, you are my go-to doctor in so many ways. Last week I called you and you picked up the phone and you're like, is everything okay, right? Because you're like used to me calling you because there's a problem. You know, I mentioned to you that I've been really looking into food. There's been this whole concept of the food pyramid being upside down, and my kids are getting older and we're starting to have conversations about what we should eat. I'm getting older and I'm starting to wonder what I should eat. And I had a conversation recently with someone who I think would identify as a carnivore, really big into meat and eggs and butter and milk. And I left the conversation thinking to myself, well, I know that there's another perspective, another point of view where somebody who I admire and think very, very highly of, that is, of course, you, has chosen to become a vegan. And so I want the audience to hear from you so that they can really hear both perspectives and make their own decision. I think you're a brilliant doctor. You're also not one of the sheep. And I'll say this bluntly, there are many, many doctors out there who I believe are behaving very sheep-like. They, read the research and they hear whatever it is from the FDA or the AMA, and they just go ahead and comply. And you are also the doctor who I called when the COVID lockdowns were happening, and I asked you whether you think we should keep living our lives, and you basically said absolutely. I mean, you were against the lockdowns. And so we have built a lot of trust over the past few years, and your feedback and your decision to become vegan is very interesting and one that I think the audience should hear about. So let's start by let's talk about what you do and who you are and just your incredible resume.
Oh, well, thank you for that great history of our relationship. It's nice to be trusted by you. It means a lot. I am a board-certified plastic surgeon. I treat breast cancer and breast cancer reconstruction. And so I spend a lot of time really helping patients surgically get back to being normal again. And I have a lot of patients that I guide through tough times in their lives. So, it really has been a journey for me in terms of figuring out this diet situation for myself. Because as a physician, we're really not taught nutrition. And I hate to admit that, but we're taught to administer medication for problems. And it's a problem-based model, which works to some extent. But what I found out as I got older and my parents got older is it doesn't really work for patients, really. I mean, what we would want is let's all live till a nice ripe old age well, and then pass away in our sleep at 100, right? Like that's what I would want. And I don't want to be on 10 medications. And all of those things, those choices we make throughout our lives, can we make them better so that we have that outcome? And I think we can.
I remember when we first met, you were actually on some form of keto diet.
Right.
And I remember about 4 years ago, we were having dinner and you basically said, well, actually, I don't eat meat anymore. I've decided to become vegan.
Right.
And so remind me a little bit, what made you choose to do that switch?
Well, we had a very close personal friend who was actually our groomsman at our wedding. And he, we're getting now into our late 40s, 50s at the time. And so he had a special type of scan that checks for how sclerosed your coronary arteries are. Now, this guy is a picture of health. He's a marathon runner. He's lean. He's fit. He's in great shape. And so he tested on the 98th percentile on how bad that his coronary artery stenosis could be. So this is a guy who's like going to have a stent and angiography, right? So how could that possibly be? He's a meat eater, he's healthy, he's conscientious, so something is wrong. So he and I started to look at diets together, and what I found was somewhat shocking. I basically re-educated myself as to diet, spent hours upon hours looking at information, videos, reading NIH PubMed, right? And really what I found was you should be vegan, right? Or at least have a plant-based diet. And the agreement between all of these massively different sources is so strong that really I couldn't deny it. And I don't even like vegans. I didn't want to be vegan, but the evidence was too good. And now that I'm used to it, I love it.
Talk to me a little bit of what evidence you have seen that changed your mind.
Well, the first most powerful thing is that if you look at the number one killer in America, what is it? It's cardiovascular disease. So in societies that are vegan and plant-based, they don't have cardiovascular disease, right? So it can even be intermittent meat. It can be blue zones. Have you heard of blue zones before?
Like Loma Linda.
Loma Linda.
I know Loma Linda in California.
Right. So these are, Loma Linda specifically is vegan and they don't eat meat. Other places are rarely eat fish. And then countries that are plant-based countries like Uganda, they have no cardiovascular disease at all. That's our number one killer, right? And they have no colon cancer, right? So that alone is good. And then if you start looking through the studies, large diet studies, we're talking 5,000, 10,000 people, followed for 5 to 10 years. The vegans always have fewer incidences of cardiovascular disease and fewer incidents of cancer-related deaths.
So you bring up Loma Linda. We can take that one as an example because it's down the street from where we live.
Right.
And I know the folks that live there are generally churchgoers. They also don't drink any alcohol. They have faith in their lives, and so they have a lot of meaning in their lives. There's a lot of research that says that if you have meaning and faith in your life, you're likely to actually live longer. And so how are these studies even accounting for all of those different variables? Or let's say you take Japan and the vegan diet there. I think many folks have other additional elements of just healthy living. How do you really reconcile all of those variables and actually trust that the study is applicable?
Right. I mean, that's a great point because you can't trust perfectly any diet study, right? So if you ask me what I ate last week, would I be 100% correct? I might omit the donut,
If
right?
you ask me, I'd probably lie about it to myself first, and then if you know,
I didn't
and then
eat
to
that.
you.
What?
I never ate that
right.
chocolate.
So it is definitely prone to error, right? The reason the blue zones are they're not just long-lived people. They're the longest lived people on the planet. We're talking, there's like one of them has like 20 centurions there, right? So these are extreme. So it's not just the diet, it's also the family and the community-based and having a behavior that works around health and wellness. So, you're not going to see them all hanging out, having football, drinking a beer as much as you are for, you go to Loma Linda, they're all biking in the hills and the guy who's 80 will pass you on his bike, right? So it's just a whole behavior that goes with a set of healthiness. So that's an extreme. So you can't certainly say, oh, it's just the vegan diet, it's everything. Mm-hmm. But when you look at these huge people-based studies, you see even in a small group of people, you'll change them to vegan, and then they have a 20% reduction in their coronary artery calcifications, right? So if you can isolate just the diet, it goes on to prove out that those things are better for those people.
What about the other illnesses? Brain disease and all of these other diseases that we may want to think about. I think if we only focus on the heart and then everything else is malfunctioning, that would be an issue as well, right?
Right. So you're looking at kidney disease, better with a vegan diet. Alzheimer's, lower with a vegan diet, right? GI upset, disease, inflammatory bowel, colon cancer, better with a vegan diet. And believe me, it's like, I wasn't, when I was looking for this, pushing veganism, right? I don't even like the word vegan. It's really more of a plant-based way of eating. So you should be shopping around the outside of the aisles, not down the middle, picking up bags of orange food and chips, right? So part of it is just eating those whole foods and not eating highly processed meats, smoked meats, foodstuffs, starchy, nasty, high fructose corn syrup. It's all of those things need to be eliminated.
The point you made is the point that the carnivores would make as well, right? That you should stay away from the processed foods, stay away from the sugars. I think everybody agrees on that. It's where that Venn diagram, kind of hits, where everybody can eat nuts, everybody can eat avocados, olive oil, et cetera. And then the disagreement is on, well, should you eat meat? Should you stay away from meat? Should you mostly eat legumes and carbs, right? I think that's really where I'm struggling to understand or really decide on what kind of diet to choose. And my concern with veganism in particular is that most of the folks that I have seen that have chosen a vegan diet will eat highly processed, carbohydrate-filled foods, like some of the items here, which we can talk about in a minute. But I associate veganism with eating pasta, with eating crackers, with eating oatmeal and cereals, and all of those things are the things that you find in the middle of the supermarket and not on the outside of those, what you call the outer aisles.
Mm-hmm. And I mean, I think that's actually why a lot of vegans call themselves plant-based. Because plant-based, no one picks up a box of processed crackers that are a weird orange color and they can say in them no animal products and thinks, oh, this is good for you. Mm-hmm. It's really the plant-based. No one thought that was plant-based. Plant-based is what's good for you. It should look like a plant. It should act like a plant. It should taste like a plant. It's supposed to be a plant, right? Or something that you can have memory of that plant is part of what you're eating, right?
And so what are the things that you're eating? You're not eating pasta. You're not eating meat. You're not eating fish. You're not eating eggs.
Right.
What are you eating?
This just sounds depressing when you put it that way.
It's a very serious conversation.
Well, like, I'm a mom and I have 3 kids. And you have to feed your kids. And that, by the way, is the hardest thing to get going, which is like, what do I feed my family?
I mean, lettuce?
Right. No. Of course, there's a lot more good things to eat. And each of those people is a different part of their lives. I've got a high schooler who rows, so he needs to consume 4,000 calories a day. I have an 11-year-old who's growing, and then I have a teenage daughter who's probably at her perfect weight. And so everybody eats differently, and so it is really, really tough. So like you develop 1, 2, 5, 10 go-to recipes that are fantastic for you, right? So maybe, some of your family is eating a pasta base or a brown rice base with a generous, fantastic vegetable toppings on it that are grilled up that has like Thai peanut sauce on it, right? And so maybe the people that don't want to gain the weight aren't doing the 3 helpings of rice. And the people that really want the vegetables are doing the veggies with a healthy sauce, right? So you can have some flexibility in what you're eating and still be vegan. Tacos, burritos are like a gift for vegans. I mean, you can do everything with those. You can do them 10 different ways and they're fantastic. Spaghetti with meat sauce, you can do vegan and it tastes perfect, right?
So we're going to talk a little bit about the carbs, and then I want to talk about soy and some of the meat replacements. But back to the carbs for a minute. So I think you would agree that consuming sugar is bad for you.
Yeah, straight up sugar.
Sugar is bad for you.
And high fructose corn syrup is the devil.
And so those are the devil, and everybody agrees on that. If you're eating pasta and rice, is that not going to effectively turn into sugar in your body? Isn't that bad too?
I mean, pasta and rice ultimately turns into sugar, slow sugar. But your kids need to eat carbs. They're growing. So if you have a child who's consuming, like my high schooler, 4,000 calories a day, you're going to make them eat that in burgers, right? It's not responsible. They're not well. My son would eat fast food and burgers and Chick-fil-A, and he was covered with acne, inflammatory. And when he switched over to trying to get more of his sources from beans and healthier sources, he cleared up. Like he got better and he felt better and he performed better. So that worked really, really well for him.
I have noticed that there are a lot of kids, especially teenagers, that have struggled with acne. And do you think that kids around that age who would switch to a vegan diet would see positive results for their skin?
Well, if it's, again, the vegan diet is a plant-based. So like beer and French fries, well, that's a really bad idea for the high schoolers especially, but that's vegan. So it has to be the plant-based, and also the meat, the fat, that's highly inflammatory for a lot of teenager skin. So it's going to be very hard to clear up their skin. But if they go on a really clean anti-inflammatory diet, which is also plant-based, it really clears them up and it's good for them, right? And it's like these are the kind of things that you need to try it with your child, because if they work, it'll teach them habits for healthy eating for their life. And it shows on their skin, it shows in their mood, it shows in their depression, it shows in their sleeping, and the proof's in the pudding.
What in the studies that you have read has informed you that eating animal products is bad?
Right. So there's multiple sources. So when you eat high protein, high fatty diet, those things break down and they have inflammatory mediators in them, right? So you get a bump and all of these multiple mediators can be checked through your bloodstream, for example. And so it's different people respond to things differently. Right? Mm-hmm. So, it's just like eating sugar. Like I could have an apple and spike my insulin to a higher degree than if you had an apple. Same thing happens when we eat meat. Some people process it slightly different. All of the meat is broken down and not added to your muscle, and most of it is excreted through your kidneys. So, those things are not great for your system, for your kidneys, for your processing. And what I'm finding over time, especially with my kids, is if they could get it from a plant protein, like if you're making a protein shake, they'll have less issues with their skin and well-being than if they're getting it from a meat-based.
But don't we need something, like let's take milk, for example. Mm-hmm. Don't we need natural milk for calcium?
Mm-hmm. Oh gosh, that's a whole bunch of no's. Okay, so the first thing is milk has galactose in it. And so why do we drink milk? Why is it supposedly good for us? I'm not sure. Calcium is not the way that you deal with osteopenia or osteoporosis or helping your bone density. Guess what? It's vitamin D. Milk does nothing for you. Calcium does nothing for you, right? Calcium supplementation is not the way to make your bone denser. It's vitamin D. That's number one. Number two is there's a fantastic Swedish study years ago. It's probably now back to like 2017, where they had 3 groups of women and they put them on either a category as no dairy, 1 dairy, or 2 dairy products per day. The women and the high dairy intake, guess what? They had more bone fractures and more morbidity and mortality from all causes. Now, I'm from I don't know if you know this about me, but I was born in Madison, Wisconsin. That's like milk country, right? So my mom would hand me a glass of milk and say, you drink your milk, it's healthy for you. So when I learned milk was supposedly not healthy for me, I was like on milk strike. And so I was still drinking milk. And so I would have my coffee and I'd like sneak milk into it. My husband's like, wait, why are you drinking milk? I was like, but can I just have it in my coffee? Right? So the evidence for why is milk bad is because milk, lactose in milk, even temporarily breaks down to galactose. Galactose, when your baby's born and they test for galactosemia, is bad. Right? So if you have galactosemia levels, even trace ones, there's a little bit of an inflammatory protein. That's an inflammatory sugar, actually, galactosemia. So the galactose, right, causes this transient inflammatory state. And it turns out to be bad for you, not good for you. And as you get older and you process it less well, it actually increases your fracture risk. So the way we think of milk is backwards. That's why when milk advertises, they can't say, well, like when I was growing up, they used to say it does a body good. Haven't heard that in a while. Now then they say, what do they say? Milk. They have an athlete with a milk mustache and they say nothing. Because you can't say anything good about milk because there's nothing good to say.
What about protein? So you mentioned protein.
Right.
I think when people advocate for a more carnivore diet, they say that vegans don't get enough protein.
Right.
And that is, especially you have a son who is an athlete. Doesn't he need protein?
Well, the protein debate is big athletes believe that you should have protein. But some of the biggest, strongest athletes are vegans, right? And what are the biggest animals? Which I heard this and I thought it was a great argument. The biggest animals, the strongest animals, do they eat meat? Strong as an ox. What does an ox eat, right? But I think, it's easy to make the case that you can be big and you can have big muscles on plants, right? And the case is made for you by looking at the animals that are strong.
Well, one of the things that you make me think about is if you're talking about animals and just evolution in general, humans have been eating meat for a very long time. We evolved with eating meat. And I read somewhere this analogy of what if you suddenly handed a soy burger to a tiger, how would the tiger react? Probably not favorably. And so would you apply that same logic to us humans? We have evolved eating milk, eggs, meat, and now we're saying we shouldn't eat it anymore.
Well, I think all of that's pretty debatable, right? I mean, you can imagine that there's a farm where people keep animals, and so they're eating off the land, off the farm, and then occasionally sacrificing an animal and eating that on not daily schedule, right? And if you look at the way places that are not as part of capitalistic society are, like, back to Africa, these villages in Africa are not going out and getting their meat every day and eating it 3 times a day. They're actually vegan and plant-based. So the less further along society is, the less meat many of these places are getting and eating. So I would say that's a good argument for, okay, I'm not saying you never eat meat, but is that really our main source of sustenance as we were evolving? I would say, looking at the way people are in the world, the least evolved people eat the least amount of meat, hard to preserve, potentially carries diseases, and no proof at all that it's good for you. So I think that's like, the people who say that meat is the way we grew up, as they're kind of hanging by their fingernails there.
So interesting. So what about some of the things that we do know that we get from meat or animal products? Like we talked about protein, but there is B12 and then there is omega. That's another thing that people say about vegans, that they're probably deficient on that.
Well, B12 is a big issue, because if you are a vegan, you will be B12 deficient. You have to supplement B12. And if you ask a vegan, well, how can you justify that that's the natural way of eating? They'll usually say, well, because we used to eat dirt in our plants and it was in the dirt. I'm like, okay, that's a little bit of a weak argument. And I think it's actually a good argument for intermittently actually having some meat supplementation to your vegan diet. But yeah, you need B12 if you're vegan, absolutely.
So you would eat a piece of steak every once in a while to get some B12 into your body?
I would. The problem with being vegan is you don't want to eat meat anymore. Like, I'm not particularly anti-meat. When I started doing it, it was for pure health reasons alone. And also to support my husband, who I felt needed it more than I did, right? Because he has cardiovascular issues in his family. And I'm already older than him, which is not that fun. And so
but you don't look it, so that's all that matters.
Well, I love you. The other thing is, I don't want to, I'm in marriage for life, right? I don't want to be retired and whatever day that will be when I'm 70 or 80, and then I don't have my husband there to have fun with me. I am in this for the long haul. So if I have to be vegan to have him be vegan, I am going to be vegan, right? So one of the reasons I did this, because I kind of feel myself as I'm from a really long-aged family, as I felt like I needed to do this for our family unit and to be there for him so he could be there for me, right? I mean, I'm going to be having fun when I'm retired. I'm not going to be geriatric and able to barely climb stairs. That's not going to be me.
Do you feel like switching, it's been 4 years since you've been a vegan, do you think that switching to the vegan diet had a positive impact on your energy, your sleep, your mood?
Well, definitely. So I was almost keto before I switched. So when I first switched, it really felt like it cleaned up the way I was eating. So I would commonly get really, really exhausted after lunch, and I would feel a little low. I also cleaned up some of my carb eating. Was if I ate carbs at all, it was very intermittent and unhealthy. And so I basically don't eat unhealthy carbs anymore. So I was keto with maybe once a week I would eat something bad. And there's nothing like a plate of waffles to floor you for 4 to 5 hours, right? And then the keto, you're really, if you're most of the time not any carbs at all, your brain isn't using glucose for energy, it's using ketones. So that's really not what we're meant to do. So I felt like balancing my diet out gave me much better energy, better mood, better sleep. And then I had my labs checked prior to, LDL, HDL, which we know everything got a lot better. So it wasn't like I had LDLs of 400, but they went from a fairly 150, 180 down to 40, which is obscenely healthy, right?
Can you explain to me what you mentioned the ketones or being in the state of ketosis not being good for you. Can you explain that?
Well, some people don't feel good when they're on ketosis. They don't think straight. They have low energy, right? Because your brain is using a secondary source of energy, which is the ketones, which they make backwards from protein, rather than taking in the sugar and just using the sugar.
So you're saying that actually our brain does need the sugar from the carbs?
Yes, and it will make its own sugar. It's called gluconeogenesis, where you actually take something that's not sugar, that's got a sugar as part of the structure, and actually make sugar out of nothing, or makes a ketone, which is little slightly different version of a sugar alcohol, uses that in order to feed yourself so you can think.
Okay, so speaking of brains, I think of omega. And so if you are a vegan, how do you get your omega?
These
Omega
awesome
is so
things
important.
called omega pills.
So I'd imagine that anybody listening to this is saying, okay, well, you're not eating all these natural foods that your body is missing, and you need these things. And so now you're taking these manufactured supplements to basically supplement all the stuff that you could have been eating through an animal diet.
I mean, I totally disagree with that. First of all, everybody, even if you live in Southern California, should be on vitamin D, right? So if you have this thing, oh, it's going to be perfect, my diet will perfectly give me everything, get over it. It's not. Start taking the right supplements. It's good for your health. So that's the first thing. The second thing is, oh, you would have perfect if you were having a meat-based diet. I wouldn't need to do anything. Yes, first of all, you have no fiber. So I don't even want to look at the inside of your colon. One of my best friends is a colorectal surgeon. Whenever she gets someone who's like a big keto meat eater, it's like polyp, 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 polyp. Like, you're supposed to have fiber. Have you heard that before, Marissa?
Yes. I have heard about
so
fiber.
How about the whole fiber being an important part of your diet? You're not going to meet that many people who are vegan who have low fiber. So you're going to have a healthier bowels, healthier colon, less inflammatory state. Those are a very healthy part of your diet. So if you're upset that you have to take some B12, I think get over it. Take the things you have to take to have a healthy you, and then make the basis of what you eat healthy so that you overall are in a good position going forward in aging so that you're going to be healthy.
So you would say eat a vegan diet and take vitamin D, take B12, take omega. I've read before that oftentimes when people take these supplements, they basically urinate it out. What are your thoughts on that?
Yeah, I mean, that's mostly the vitamins, right? Some of the vitamins are not very good because they pack it into a capsule. And
or they bleach it, or
something bad. That's actually a great argument. For a vegan diet, so many of the vitamins that we need that are critical, basically every single one except B12, are already packaged in the foods that you eat. So, you don't need to sit there and supplement with all the vitamins except B12, which is very, very readily absorbed because it's already in the food that you eat. It's packaged for you in the form of your broccoli and your kale, right?
So you take the vitamins, you eat a vegan diet, you don't need protein from animal products because you get it through soy. Let's talk about soy.
Right.
Because some people say that soy is the devil, and some people say that soy is the angel. And you're in the angel camp.
I'm a huge soy believer. Soy, I mentioned earlier that I treat breast cancer patients. The data supporting soy being healthy for breast cancer survivors is overwhelming. It drops your risk of a recurrence of breast cancer by, between the 3 different studies, 30 to 50%. I mean, you can't ignore that. And why does soy do that? Because soy in humans, not in rats, blocks a type 3 estrogen receptor in breast tissue. That means if you give soy to your daughters at a young age, they actually have a lower risk in their lifetime of having breast cancer. Soy is good for them. It doesn't act as estrogen. It actually blocks the estrogen receptor in the breast. And it does the same for men. It does not make your breasts grow in men. It does not make your boys' breasts grow in men. That's all completely untrue and based on rat studies.
Where is this myth then coming from? I think there are many people who are listening right now who will say that they've heard that soy is bad, especially for young boys, that it's bad ultimately for their testosterone. Where is this coming from?
Right.
Is it a complete myth?
No, I think around the year 2000, where a lot of our diet study was done in animals, that was the prevalent view. There are still oncologists who will say to my patients, don't eat soy. And so then I give them a nice copy of the JAMA article published in 2014. I said, try cracking open a medical journal. It absolutely decreases the risk of recurrence for breast cancer survivors. And also it decreases the risk for all of us women. All women should be taking a minimum of 1 cup of soy per day as a treatment to prevent breast cancer.
So you would actually say make it a point to drink soy milk. So your mom who used to hand you the glass of cow milk should have handed you the glass of soy milk, you would say.
I absolutely agree with that.
Are there any risks in drinking soy milk?
Some people have a diet sensitivity to soy. They just can't drink it.
But that's like an anomaly. In
Yeah.
general, you would say soy products are great.
Plus, 100%.
Okay, so I have a soy product here.
Yeah.
I just want to look at it. And I have some vegan products here because my reaction when I look at some of these products is that it's not natural and filled with seed oils. I want to talk about the seed oils, but let's take a look at this one. So this is a yogurt that is soybean. It has made out of soybeans. It has cane sugar. Now I know you're not a fan of sugar, but I would say that probably a yogurt like this made out of cow milk will also have sugar in it.
Yeah.
Right? But then there is cornstarch. I mean, maybe you could take a look at some of these things and tell me.
I mean, there are great yogurts out there, because yogurt's one of those things like kombucha and all these kind of probiotics that are good for our gut. So they've taken soy, which is a good product. They basically didn't ferment anything, and then they added sugar and cornstarch to it. So this is not a great example of what you should be eating. Is this the devil and kills you? No, it's like a sugar added soy product. So if this was my one serving of soy for the day, I could probably make a better choice because of the sugar added to it and the fact that I'm missing out, if I like yogurt, on getting a probiotic, which is so important to our health, is to eat things that are good for our gut, right? So I'm going to give this like a C+, B-.
Okay, almond milk. People are obsessed with almond milk.
Yeah.
And, I see this, people drinking, glasses and glasses full of almond milk.
Right.
This is kind of a mainstream brand. And the thing that I immediately see when I look at this, aside from the basics like salt, et cetera, and a bunch of words that I don't understand, there's seed oil in here, sunflower oil. Aren't the seed oils bad for you?
Yeah, there's now coming out more information about how bad they are. So oils in general, remember how they used to tell us healthy heart oils, canola, it's so good for you. No, it turns out it's terrible for you. So any kind of oil that can be expressed, like olive, from the olive oil, you pinch a piece of olive and the oil comes out of it, right? So any oil which is naturally occurring is thought to be way, way better for you than something that has to be heat processed, created, like corn oil, canola oil, all those things. All those seed oils are created in a way that turns out to be destructive to the element itself and bad for us. And so they're not heart healthy. So I don't love that that's in there. But let's say you pour yourself some almond breeze and let it sit on the counter. Do you get an oil layer in it? It's not a lot of oil, right? So I would say I'm okay with that one.
You would rather drink the almond milk with a little bit of the seed oil than cow milk.
That's right.
Because cow milk is just so bad for you.
Well, I don't think it's good for you. Let me put it that way. I do think it's a little bit of badness every time you drink it.
Okay, so this is, I can't tell you how different and upside down this is from my last interview. Let's talk about the Beyond Meat. Okay, so the last person I had on the show basically called Beyond Meat the devil, or any of these fake meats. We'll call them a fake meat. Would you eat the fake meat?
I don't really like it, no.
Okay, so who is this product for if it's not for vegans?
Well, I think some people like me are very much sold on the vegan diet, and they look at it, or their doctor says, oh, you should be vegan. So then they're like, oh, I can't, I have to have a burger. Yum, I'm gonna have this. This is vegan, but really it's full of other bad things. Although they may not be animal-based, that doesn't make them good for you. There's preservatives, they actually take the heme, and they put this iron in there to make it taste like blood. That's not really our idea of being vegan, is to eat other unhealthy things. Just because they're not from an animal doesn't make them right.
So you would say that, I guess, the food marketing folks have figured out that there are a bunch of people who want to be vegan,
right.
And so they take advantage of this kind of new idea or ideology within food, and they actually create products that market towards vegans, but it's actually not really what you mean by being a vegan or what you would want to eat.
I think that if you're trying to get a meat product, a meat-like product, and that's unhealthy, then you're kind of ruining the idea of being vegan and plant-based, which is to eat something that's from a whole plant. So I completely agree with your guest who didn't like this. I don't like it either, and I don't like eating meat. And, I would just as soon probably eat the occasional meat burger as eat this.
What about fish? Salmon?
Yeah, so sometimes like I might go to dinner and there's nothing on the menu for vegans, and then I'll eat fish.
Why not choose to eat fish? Why not be a pescatarian then?
Right, because the same proteins you're eating in the salmon that are giving you these daily inflammatory mediators and taxing your kidneys and coating on your arteries, like those things are in there too, right? So are you occasionally eating that? And that's okay. For most people, I would say that that's true. But if you're going to really embrace vegetarianism, save it for the time you're out to dinner that they don't have the Caesar salad. Let's not cook it every single day, because then you're not getting the benefits of being vegan.
Are you able to explain the science behind what is in the fish that causes the inflammation?
Right. I mean, it's actually looking at the proteins and the way the proteins break down in your stomach, go into your bloodstream, and how those things are processed. And so it takes your body a lot more work and creates a lot more inflammatory mediators. So you can actually detect those in the blood. You can actually see them in the blood, in the serum if you spin the blood down. And then if you look at people's inflammatory markers, they go up after a high protein meal. So it's not, the question is how much damage is it doing, right? So some people could be causing a lot of damage. Some people could barely be causing damage at all, right? But overall, if you look at populations that eat meat on a regular basis, they will have more cancers, they will have more cardiovascular disease. And that's why not to do it, right?
What about eggs?
I mean, I don't eat eggs.
You don't eat eggs. Obviously, you're a vegan. So is it the same answer? The reason not to eat eggs is the same answer, the same
Well,
answer
there's
you'd
like
give for
less
fish?
badness, right? So most vegans don't eat any eggs, any meat. But if you're going to look at what causes the most amount of inflammation and is the worst for you, it's going to be, red meat, right? And then it goes down from there. Chicken, maybe not so great. Fish, maybe not quite as bad, right? And then eggs might be right around the same range as those other things.
What about just the egg whites?
Right. I mean, people talk about that being better because it has a different protein content that's less inflammatory, but I'm not making egg white omelets either, so I can't speak to that.
Still rather stick to the soy,
I would still
the
rather
nuts,
stick.
and the beans.
I think if you give yourself a million exceptions, you're not vegan anymore.
Right.
If you want to be vegetarian and you want to eat cheese and you want to have the occasional egg, okay, maybe that's your choice, but don't call yourself plant-based. Obviously, that's not the decision.
I know you love beans because they have protein, but they also have a lot of carbs.
Right.
You're okay with that?
I'm okay with that. I think I am. Right.
Yeah. I mean, you're obviously skinny,
right.
But
beans are great. They're so good for you. And every one of those blue zone populations we talked about, where people are living routinely into their 90s, they all involve beans and nuts, every single group, right? And you look at people from Mexico that have beans in their diet, they outlive us by 4 years. And so if you've ever seen a traditional Mexican diet with the tortillas and the rice and the pork, you think, how is that possible? It's the beans.
Wow.
So beans are so good, they undo some of your other hideous health habits. So if you can tolerate beans, you should be eating beans every single day.
And a cup of soy milk.
Yes, you've got it.
All right, we've mentioned weight for a minute. I want to dive into a different subject, and that is the new drugs that are on the market right now, whether it's Ozempic or Wegovy. I think there's a third one. I want to hear your thoughts on that. Are you giving them to any of your patients?
Well, I don't treat people for diet, but there are cases where I do want people to lose weight prior to surgery, and I won't hesitate to give it. Also, there's a lot of doctor chatter right now because it's becoming a much more hot, much more talked about and prescribed item. And so what's been said is actually, it's fascinating that people respond to it the way that they do. Because what's great about these things is that they interrupt, not only do they tell you you're full, right? They're signaling you don't need any more food, right? So a lot of things happen when that happens. It increases your insulin levels, not to get too down into the weeds.
Well, get into the weeds. I want to understand this drug because everybody is talking about it.
Yes.
And I'm hearing doctors fighting about it.
Right.
And I just find the whole thing fascinating.
Right. Well, two of us in my office are like at war with it right now because I love it and she hates it. Her argument is, you're going to take this drug to get thin. It's going to make you feel full. You're going to eat less and you're going to go off and just get fat again. So what's the point? My argument is I'm watching my patients who take it. And so there are so many women I take care of that, and I remember I said breast cancer, I have patients that take anti-estrogens like tamoxifen, right? And so they can't lose weight. Why? Because it's completely screwed with their balance and their metabolism. And they'll say to me, oh, Lisa, I eat 500 calories a day and I'm still gaining weight and I exercise 5 times a week and I'm still 25 pounds over. That's the kind of person, if you give this medication to them, it changes their relationship with food because it also interrupts the relationship between their gut and the brain, called the gut-brain axis. And so it starts to tell them, I don't need to have sugar. I don't need to crave sweets because I can make the best food decisions of my life because you're not influenced by these kind of crazy sugar urges like we always are because your brain is not telling you anymore, eat, 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 eat. And they stop drinking Diet Coke. I mean, that's weird, right? Like, why would you still drink Diet Coke? They've stopped binge eating. Right? And so they're eating better than they've ever eaten before. So it's a great way to stop bad habits, to increase your awareness, and to get rid of this kind of like hormonal influence over what we eat and understand what you're really doing.
I can definitely see how it would give somebody a leg up, somebody who struggled for a very long time with losing weight and had, immense cravings. And suddenly they're able to start shedding the pounds. It's like positive affirmation, like, right? You can do this.
Right.
And then once you lose that weight and you buy the new clothes, you become more confident. And through the confidence, you hopefully can maintain that if you couldn't do it naturally. Otherwise, I definitely see how that mentally can really just help people. But part of me is wondering, it's a new drug. Are there any risks? And also, how does someone learn how to wean off something like that?
Right.
I mean, can they just become so addicted to the help that it provides them that they actually won't learn how to build natural habits that would be long-lasting? So 2 questions.
Yes,
Side effects?
I'm taking them, number 1.
Right, so we'll start with the side effects.
The side effects. So the side effects are often everything related to the feeling of being full. So people can have nausea, people can throw up, people can feel sick. Why? Because it just kind of stops your gut. It's like, okay, no, we're good. We're just going to keep that right there in the stomach. And so that food being right there, if you just ate, doesn't feel good to a lot of people, or that makes them have a sensation that they're going to throw up. I had a good friend who took it for like a 10-pound weight loss, ended up spending the entire time in a bathroom at a conference barfing. I mean, these are true side effects of this medication, right? It also, you're not doing a lot of other things when you're not eating. You might be not drinking, and you're meanwhile dumping tons of fat and breakdown products of your fat back into your system. So it's very taxing on your system. So people, especially very obese people, should be watched closely because all of these fat metabolites will be dumped into your system and it can kill your kidneys. So you gotta be, if you're fat, you need to be under a doctor's orders and you need to be watched. Even if you're a little bit heavy, the doctor should be counseling you how to make these a lifetime set of habits because you want to be on the drug all your life. The drug increases the secretions of the pancreas called, insulin, of course. There's also amylase and lipase. And so we don't want necessarily those amylase and lipase breakdown enzymes constantly being produced your whole entire life. What are the consequences of that? We don't know. So this is not really meant to be a long-term drug. This is kind of a weight loss realization drug. And if we can use it to develop healthier habits, it can really give us a nice kick and get us going. And you know what really hurts me when I talk to my patients that are heavy? When you get heavy enough, the fat itself is metabolically active and it makes it harder to lose itself, right? Fat is harder to lose once you're fat. If you're 5 pounds overweight, it's not that bad, right? But once that starts to produce its own estrogen, produce its own inflammation, then all of a sudden you're like, I can't lose my weight. And I've been trying and trying. They'll struggle and they'll be down a pound in a week after feeling like they starved themselves. So, to get rid of the burden, to get out from under the extra, and then realize, how am I eating right now that's letting me eat that? Because guess what? It doesn't burn the fat for you. It doesn't change your metabolism. You change it by eating differently. All you need to do is look at how you ate and eat that way as opposed to the way you had been eating before. Don't go back to who you were. Be a new person.
What about the potential long-term side effects? So you talked about side effects that are, okay, well, I'm feeling a little nauseous. I can work through it. What, cancer, heart disease, anything like that?
In the original rat studies, it was found to bring out medullary thyroid cancers. So That hasn't happened in humans, but nobody wants to give it to anybody with a history of thyroid cancer because it's just too scary that might stimulate an underlying issue for those patients.
Is it possible that because the product is so new that we don't know about any long-term
It's not that new, actually. The whole semaglutide and all of those things have been on the market for well over 10 years, used by the peptide industry. And they have been, since 2000, people have been able to get them in one form or another. They all work a little bit differently from one another. There are short-term acting ones that only work for an hour that have been used by diet specialists for years. So we know more than nothing. It's not like, oh, this just happened yesterday. And we have not seen risk factors in those populations. But, fen-phen, do you know what that is?
Yeah, I remember that.
Right, like when they first came out, it was years till people started having cardiac issues. Could that be the next thing? We don't think so, because that was an amphetamine. Turns out amphetamine's not great for your heart, but it could with the gastric secretions, amylase and lipase, chronically inflamed pancreas. That it could be an issue, and that's where the issue would likely be.
Do you think that if somebody could motivate themselves to work out on their own a better diet without taking a medication or a supplement, it's worth exhausting every one of those possibilities before getting on the drug? Or do you think that, taking the drug is so helpful that it's just worth going ahead and doing it because it resolves years of battles with weight?
I mean, I would say, obviously, please exercise, eat healthy. That's number one. But if you were exercising and eat healthy truly, you may not be looking to me to prescribe you this drug, right? There's something that's happening in your system that's creating this problem. And what I think is fun about it for me is I hear a lot of excuses from my patients. And this sounds mean, and I don't want to sound mean. I just want to sound realistic.
You're a surgeon.
Okay, I'm a little mean.
You're a surgeon, and surgeons are always very direct.
Just a touch mean. I hear that people give themselves excuses, but really what they're doing is mentally undermining themselves and giving them permission to do things they shouldn't do. I can't tell you the patients to say, well, doctor, I'm just overweight and need this liposuction because I'm hypothyroid. Really? Because you're on thyroid and your NUF levels are normal, but I'm just hypothyroid. Oh, doctor, I can't lose weight because I eat perfectly. I have someone really close to me who was like, I'm just 15 pounds overweight, but I look good enough. Who cares? They started taking this. They're like, oh, what I didn't realize I was doing is I walked into the kitchen at night and my husband would be cooking for the kids and they'd have chips out and I just grabbed 10. And then I'd be scooping up the ice cream and I would just take some bites. And it's all these little things added up. That was the person who lost, scarily, a pound a day. This person who ate perfectly and could not lose any weight. So this is why I love it, is because you drop the excuses and you see what is it you are really doing.
How does the drug help you do that?
It shuts down that gut-brain axis. So your brain tells you all these things about what you should be eating, but you shouldn't be eating them and you shouldn't justify eating them, right? I've had a terrible day. I worked so hard. No one got me any dinner. Am I just describing myself here? Right?
It sounds like
Where's my dinner someone made me? Didn't happen. And then you grab the one thing you grab, and that was the thing you shouldn't have grabbed because your brain is so powerful. It wants so badly for you to stay exactly who you are and not be the person you imagine you want to be. It will work and mentally
sabotage you.
Thank you for that word. That was not the one I was thinking of, but I was trying to come around to it. It will absolutely do that to you. And once you break that connection, you realize where it is that you're falling down and why. And that's very powerful. And it takes away your excuse. And your excuse is always just a lie.
Oh my gosh. Okay, so what about what your colleague said? Your colleague made a very valid point, which is once you're not on this drug anymore,
right?
How do you make sure that you don't just start eating all over again?
Well, I'm watching people I know who have been on it for greater than 6 months who are at their goal weight. And so generally these are now, I'm not talking about obese people. These are people that are 20 pounds, 30 pounds, maybe 40 pounds overweight. And so what they do is they get down to where they want to get down to. And then one of them uses it as a crutch. So once a month takes a 1 milligram dose, which is very, very low, just to kind of just stay. Another person started working out, which she could never do because she was so heavy that she would feel like she couldn't control the movement of her body. It was just too much real estate to deal with, right? And she'd get exhausted and out of breath and out of shape. So some people have permanently changed. Some people are still using it as a crutch. My favorite would be, of course, be the let it be, the catalyst for change and not use it as a crutch. That would be ideal.
So what would be the way to do that? If a doctor is prescribing the drug, at the same time prescribe a plan for when to wean off of it, and
I love that.
as well as how to eat healthy and exercise when you have this kind of extra support so that you can continue doing that further. Are doctors doing that?
Marissa, you'd be a good doctor. Why don't you just do exactly what you just said? Yes. I mean, setting up a plan would be great. And then there's so many other things to dig into, that I think doctors are just starting to, a few here and there, open their eyes to the amount of dysfunction that we create in our own bodies over our lifetime. My patients now doing other things to boost their energy and boost their metabolism, like NAD, for example. I don't know if you've heard of that. It's something that improves the behavior of mitochondria. This is something that I haven't heard first about as a doctor. I heard about because I was getting my hair done and my adorable hairdresser says, oh my God, during COVID, I just had no energy and I had to do NAD and now I have energy. And I'm like, okay, well, that's weird. That's just a strange thing. Then I hear it from a patient. Then I hear it from a patient. Then I hear it from a patient. So if I hear it from the patient, guess what? It's working. And the doctors had better catch up, right? And so really the awareness of what's out there, doctors resent it. They'll say, well, are you going to ask me or are you going to ask Dr. Google? I'm like, thank you. Ask Dr. Google. And while you're at it, ask the hairdresser and go read about it on Reddit or whatever source that you like. Because frankly, this informed patient who knows what's going on with themselves and how they feel, I feel like is the best person to get the most out of the medical system, and find a doctor who's compatible with your set of beliefs, who's listening to you. Because there's a lot for them to give you that's just not another prescription that they hand.
Well, I think it's one of the reasons why so many of us are losing trust in the medical system, and that is because we're going to doctors who, I think the doctors think that all we want is a prescription,
yes.
So that, we don't want them to hold us accountable. We don't ask them to give us work. We ask them to give us a pill. And you're seeing this also when it comes to issues of, you mentioned feeling fatigue, energy, depression, all of those things. America is, I think, the leader of antidepressants right now. I think, 30% of my friends are on antidepressants at this point. And, the question I asked you earlier as we were walking in here is, do you think depression has something to do with our diets? I'm seeing teenagers depressed too. Is that connected to what they're eating? And oftentimes the way our doctors are solving this is by giving them a pill. And so it's why I have such a strong reaction to medication in general now, right? It's like you would imagine my reaction to be so anti-Ozempic and Wegovy and all of that is because, oh my gosh, are the doctors just throwing another medication at us because that's what they've been doing? And I'm not blaming all doctors, but there is a bit of this cycle where I'm not hearing enough doctors talk about diet and exercise and personal accountability. We're hearing more, okay, let me prescribe something to you. And that example could not be clearer than in the area of depression and young folks dealing with anxiety.
Right. Let me address your first point. Let me get back to the depression. But the first point, which is that doctors have a prescription, think about the healthcare system. So how I bill insurance depends on the complexity of the patient, right? So if I can show that you have 5 problems in different systems, then I can give you a level 5 consult and I can maximally bill for how complex a patient you are. If you're healthy and you go into the hospital for a couple of days, do you make more than if you are healthy and had to go into the hospital for a couple of days? Or if you have a hypertension and you've also got kidney problems, if I can rack up a list, my coding and my billing shows that I can literally make 3 times the reimbursement from you. So, they've shown in the drug industry that if I literally give you a drug pen with Pfizer on it, I'm more likely to write you for a Pfizer script. The influence over doctors may be subtle and we might be thinking that we're purists, but money talks. And the more money that I bring as a physician and the more money I get paid from the hospital, right? Then that will influence me over time to continue to behave that way. So it's better for a doctor to spend less time with you. This is just the way the medical system is set up, and to write you more prescriptions and make you sicker. That's just how the industry is, with the exception of possibly Kaiser. And, Kaiser is the one hospital that pushes healthier eating, vegan diet. Why? Because the cheapest thing for Kaiser is what's best for me too. Get to be 90-year-old and drop over and dead in my sleep at home, as opposed to come to the hospital with 100 chronic illnesses, since Kaiser is, one fee and they take care of everything. So I kind of like that kind of healthcare, because at least we have aligned motives, right? Now back to your depression idea, depression is so multifactorial. Is it potentially diet related? I mean, absolutely, eating the wrong foods, being low energy can make you depressed. Low sleep can make you depressed. So it's not just what you eat. And then what I'm noticing in my own kids is that they self-diagnose, right? Or diagnose their friends. I've never seen more kids know the ins and outs of like the DSM-5 than our teenager group, right? Every kid's a borderline. If maybe they're manic depressive, or, they've got narcissism disorder, this kid's bipolar. So they're good at labeling. They're good at then looking and Googling what medication you take for that.
Well, that's like the negative aspect of going on Google and self-diagnosing,
looking for a cure.
Looking for cures, or looking for the problems.
I think that's true. And, when something like as a parent, so much of the ability to cure yourself lies from within, right? And now they're looking externally for how they could possibly fix their issues. And that's a pill. And that's unhealthy, I think.
So would you say that the reason there are so many folks that are on antidepressants or have been diagnosed as depressed is because there's more awareness about depression, so much so that now there's more demand for a quick fix?
Absolutely. And if you look at mild to moderate depression, a placebo has the exact same cure rate as an antidepressant, right? Because feeling like you're taking something is as good as taking something. So I wish there was ethical, I'm not sure it is, to give all these kids placebos, but they're looking to fix something by taking a pill.
It's incredible, because I would say 50 years ago, there were a lot of people who were depressed and we didn't diagnose it, and that was a problem too, right? And now people are overdiagnosed and then over-medicated, and now that is a problem. It's like the pendulum has swung in the other direction. But I also think so many of us are just so scared that the people that we love are going to be depressed and going to hurt themselves. And is it possible that that's where it's coming from, where we're hearing about kids that are committing suicide or are struggling, and so we want to do everything possible, and the system is telling us that if we give them a pill, that's what's going to solve it?
I think that looking at my own kids, what I've been told, like my little my 18-year-old, he was, as a little guy, just like, oh, he's got ADHD and he can't focus. The teachers would come to me and tell me what a problem. The principal would bring him in and say, you need to have him evaluated, right? And if you brought them to the wrong therapist, they would have also started him on medication. Luckily, we brought him to someone who was good. They're like, look, it's very interesting. He can focus on something for like 3 hours straight if he likes it. But it turns out listening to a teacher talk boringly in front of the class really inspires him to do something else, right? And that's called almost all boys, right? And so dealing with him on getting more focus and having a little more self-discipline and growing up turned out to be a much better fix than putting him on ADHD medication. But the number of people who came up to me and my husband and challenged us to try to medicate him was shocking. Right? And it's an easy thing for a parent to say, oh, my child is broken. I'm getting pressure from the system to fix him. I'm going to do what I can. As a parent, it makes you feel terrible to think you're not doing what you can do. And it's hard to hold on to the values. It's easy to talk abstractly about it. But when you're the one getting the pressure as the parent, it doesn't feel good to do nothing, and you think you're wronging your child. And that feels terrible. So there's a lot of pressure on parents. And it was hard for us to get through it. Looking back, I'm like, of course, why was I even in doubt, right? But at the time, it didn't feel that way.
Are there things that you're able to do naturally without giving him medication? Are there any recommendations for people who are listening to this, who do have a young child whose teachers are pressuring or maybe doctors are pressuring to put on medication, would there be steps that you would recommend to do before?
I mean, it so depends on what the situation is and what the diagnosis that they're looking for is. Like we started out talking about depression. There are so many wonderful ways to help with mood and elevate mood and deal with teens and therapy related things. I mean, depression in teenagers, that's like, that goes together very, very closely. So having someone listen to your child is just not going to push medication on them. So don't go to a psychiatrist, maybe go to someone who's just there as an ear. But then, I mean, this sounds very routine, but I once got the advice from a mom. She was amazing, double PhD, and she quit work when her boys were 13 and 14. I was like, now you're quitting work? And she goes, well, now's the time they need me. I just pick them up from sports event and drive with them into the car because that 45 minutes, that's where they need it. So she had gone into some morning half day because she felt if I am there as the parent, I just physically need to be there. Whether that's when they start talking, they're next to you in the car and they're like, such and such happened at school. That's the moments we need to pick up. And so I think that helps as a parent. I don't want to just outsource everything to the therapist.
Totally.
We're important.
Like really have real conversations and get them off the screen and get us off the screen.
Exactly. Yeah. Yes. That TikTok is just, speaking of the devil, that looking at what they tell your child they have. And, I heard from my daughter and all her friends about hip dips and double eyelids and all kinds of, I'm like, what are you reading? So, to look at yourself and judge, that's not going to help with a teen's mood at all. And that being said, some people are clinically depressed. They need to be under professional care and they are suicidal. But I would say 99% of them need you.
Yeah, totally. I want to play a little game.
Oh, good. I love games.
It's the game of food. We generally don't play with food. So I actually did this neat thing with the carnivore that I interviewed a while ago. And the game is like this. I'm going to read names of different types of food and you react to them. Just give me about a sentence and a half. I know it's going to be really hard. Harder than surgery because you're going to be tempted to, give me longer explanations. But let's go ahead and see how it goes. Okay. So you like it, not like it. What would you do about it? What's your reaction to it? All right. So let's start. Whole wheat cereal.
Boy, that's a tough one to start with. I like the whole and I like the wheat, but most cereals are sugary and processed.
Are there cereals that you do like as a vegan?
Yeah, there's some really good healthy granolas.
Okay. Oatmeal?
The type without all the sugar.
So when I had my cholesterol checked and it was a little high, my doctor recommended that I eat oatmeal every day.
Yeah.
Is that something you would support?
Yeah, the real good kind. Okay. Not the kind with like apples and cinnamon pre-added.
Okay.
Yeah.
Brown rice?
Yes.
Quinoa?
Love.
You love quinoa?
What's not to love?
Well, the person I interviewed last time said that quinoa is the devil.
I mean, there's a lot of devils in this person's eyes. Right. Quinoa is great for you. It has tons of protein in it, and it's a great food source.
Lettuce.
Sure. Which kind of lettuce?
Iceberg.
I mean, that's a neutral. That's fiber only. And then if you start to put in baby kale and something more exciting, it has more good stuff in it.
Impossible meat or Beyond Meat?
Boo.
You hate it?
No.
Tofu?
Love.
Avocados?
Love.
Avocados is like what fits in that Venn diagram. Everybody loves avocados.
Yes, they are delicious.
Okay, olives.
Yes.
Fatty Wagyu beef.
I mean, that's a no. I think that's not vegetarian, Marissa.
All right. How about butter fried eggs?
No on the butter and no on the eggs. Although, I mean, I actually prefer butter to like the bad oils.
Like margarine, for example?
Yeah, I don't like margarine.
No margarine.
There's a lot of gross stuff in there. You shouldn't be eating that. Yeah.
No margarine, no seed oils.
No.
Pasta.
They have these pastas that are cool now.
Not chickpeas pasta.
Okay.
Pasta.
Only for my weight gainers in my household. Otherwise, no.
No. Bread?
Same idea.
Just like white bread?
I mean, why is that good for you? No.
No. Sprouted bread?
I'll do sprouted.
So like what, the Ezekiel brand or something like that?
If it has to be frozen, it's probably good for you.
If it has to be frozen. Okay. Almond milk?
Yes.
Oat milk?
It's higher calorie, but better than milk.
Doesn't turn into sugar in your body?
Yeah, it's way too sugary. That's why I'm not giving you an eh.
Okay, whole milk.
No.
Gatorade?
Are you kidding? No. It's like
No.
sugar and salt in a container.
I know, I see all the kids running around with it, and all the kids' gyms have Gatorade.
Right. Well, anything with high fructose corn syrup, you should never give your child because that gives them a taste for it, and you're going to have a kid that hooks on candy. But you do have to give your kid a little bit of sustenance. So I'm not totally against sugar for kids like some people are. Like I said, I'll do pasta and I'll do ice cream even. I mean, I have a lot of compromising that I do because you can't have some skinny child that doesn't grow.
Yeah.
So I would let them have a Gatorade, but there's no way in hell I would eat a Gatorade. Or
You
drink a
would not
Gatorade.
drink
Never.
any Gatorade.
Or a
Okay.
Coke. No, never.
Okay, protein shakes.
Yeah, there's a lot of variability there.
Yeah. How about, I'm assuming yes, nuts. Any nuts you don't like? Any nuts you love more than others?
I mean, nuts are really high density calories, so you should not be eating handful upon handful of nuts. You're going to get like thousands of calories. But I love nuts. They're
All
good.
nuts.
Pretty
And-
much.
Okay. How about protein bars?
I think there's a lot of processing in most of them, and it's hard to find something good.
Not a fan of protein bars.
I mean, I think it makes me feel a little sick, so I'm trusting my gut.
Yeah, trust your gut. How about protein powders? Like the whey protein?
Whey, and then there's pea protein now. So, like for you mentioned getting enough protein for those building muscle. Our high schooler, just more than 2 sentences, will dump some pea protein in there and make them a delicious like multi-fruit shake. It's great and it's full of protein.
Okay. How about frozen yogurt?
I mean, what's it do? It's sugar.
No. Beans and legumes.
Yes, of course.
Acai bowls. Do you know what I'm talking about?
Yeah, ACAI. You never have to pronounce it until some friend of yours tells you. Yes, I know the thing.
Acai bowls.
I'm going to go with yes.
Yes. Seed oils, sunflower seed oils, canola, any other oils I should ask you about?
Seed oils are bad. And a few cardiologists are saying they're actually much worse than cardiac disease. So definitely no.
Ice cream.
You know, I got an 11-year-old. He likes ice cream and he doesn't eat unless I give him some ice cream. So he'll eat real food and then I'll give him ice cream. And he's like, I can see all his ribs and his internal organs. And he'll eat a bowl a day.
Is it vegan ice cream?
No,
Or
I
you
don't
let
bother.
him. You let him.
I
eat
do.
the Haagen-Dazs or whatever.
Well, he's not about to break a bone, right?
Yeah.
And I think in terms of inflammatory mediators, kids are able to deal with a lot more. So it becomes a decision to get the calories in and have them grow over other things.
So some animal products in moderation for your
Yeah.
kids.
I mean, he eats also chicken tenders, admitting it.
What about fruits?
Yes.
All fruits?
Some are better than others, but I'm
Any
not
favorites
anti-fruit.
or least favorite?
Well, the things like berries, things like that are going to have so much more nutrients and antioxidants packed into them. They're actively good for you. So if you're going to take a choice between a grape and a little wild blueberry or a raspberry, go with the stuff that's good for you too.
What about something like kiwi or pineapple?
Oh, you know what's good in kiwi? Eat the rind.
Oh, I've heard this before. It just
Delish.
grosses me out.
Just cut it up. Or get the yellow ones.
How about bugs and crickets?
I mean, every day. Is that what's in here?
Exactly.
No, gross.
Beef jerky.
Definitely no.
Just as gross as the crickets?
Well, they usually smoke it, and smoked meats have a really high carcinogenic index. As you know, Japan, #1 stomach cancer because all their smoked meats. Don't eat smoked meats. It's very, very bad for you. I have 2 relatives that died of esophageal and stomach cancer. No.
No. How about orange juice?
Eh.
It has a lot of sugar.
Yeah, it has a lot of sugar, and they take the fiber out. So now you're getting the sugar from the fruit and no fiber. Kind of like grape juice. It's not doing anything for you.
But does it have any vitamins in it? Is it good for kids?
I mean, it has vitamin C in it. Most of them are added, though. So I would say it's not good for kids. But if you're deciding between that and a Gatorade, maybe it's a little better than a Gatorade.
But pretty much no.
Pretty much no.
What
But
about
like I
coconut?
said, kids need calories, though. So I'm not anti-calorie.
Okay. What about coconut water?
I don't totally understand it.
You don't get it.
No.
It's just so
Go
random.
for it. I don't care.
Okay. All right. How about red wine? Is red wine good for you?
No.
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 I heard like a glass a day is
Right.
supposed to be good for your heart.
That's what the people who drink like a half a bottle of wine a day say.
It's better to go.
It's good for me.
It's like,
Okay.
you know how to make $1 million?
Yeah.
Spend $2 million.
That's right. It's not, I would say, look, if you're going to have a vice and you occasionally drink wine or red wine, that's probably okay, but it is a vice. Alcohol is bad for you. We all know it's bad for you. And, you know, I used to be on a liver transplant service, and we would take the livers from these, retirees having a glass of 2 wine a day. They look terrible.
No.
You couldn't use them.
So it's a myth
It's
that
a
red
no.
wine is good for you. Okay.
I'm going to say it's more bad than good. There you
How
go.
about the multivitamins, like just like the Centrums, those multivitamins?
Yeah, they go through you. You're going to do way, way better eating more plants and then supplementing the things like D and B12 that you really should have on top of that. Focus your vitamins on good sources and get rid of the pill. That's not good.
Okay. And how about coffee?
I love coffee.
Coffee's
Coffee's good for you. Yeah.
Coffee fell in the Venn diagram.
Yes,
Thank God.
coffee's good. And
Okay.
green tea is also fantastic.
tea.
So try not to drink so much coffee. But yeah, I think coffee, and then if you add the green tea is fantastic. And the more you learn about it, the more you realize that it's a huge source for longevity. So if you can add a green tea once a day to your 1 or 2 cups of coffee, you'll do yourself a lot of good.
I love it. Well, thank you so much. I learned so much. I would say my conclusion is I don't think there's one size fit all diet for everybody. People just need to do their research. I know I'm deep in it. This is a fascinating conversation. Thank you for always being there for us and for me. And Dr. Lisa Cassileth, you're a star. Thank you.
Thank you, Marissa.